Self-harm behaviors are not as common as some of the other concerns we see, like depression, anxiety, kind of acting out behaviors. But I would say that pretty much all the clinicians have a few adolescents on their caseload who they're treating self-harm. We usually see them start coming up around ages 10 or 11. That's when you're going to think of most kids are transitioning into adolescence and they're able to think a little bit more about their feelings. They're more concerned with what their friends are thinking of them and just a little bit more aware of how they may or may not be fitting in. That becomes pretty important. If you notice your teen is really isolating themselves a lot, so if they're spending more and more time alone in their bedroom, they're wearing long sleeves or really working hard to cover up different limbs or different parts of their body. And for females and for males, you might see a large amount of bracelets being worn so they can cover up areas like their wrists. For some kids, it's a way to communicate how much pain they're going through. It may be really difficult for them to put into words what they're experiencing, but they might be able to inflict pain or other wounds to kind of show people that this is what I'm going through. Sometimes kids self-harm because they want to feel like they're part of a group. They might self-harm so that they can talk to other friends who are self-harming about it. Then the third reason, it's a way to manage emotional pain. So a lot of research has found that when teens inflict physical pain on themselves, it can provide relief from emotional pain. My advice to them is always to try to be as matter of fact as possible and keep it short and simple when you're talking to your teen about self-harm. So your goal should be to communicate to them, I want to support you and I want to help you find new ways of coping with what's going on. I tend to think of self-harm as more of a symptom of other things going on, and it's not necessarily the main thing that you want to focus on. We really work on helping them build new skills so that they feel like they have better ways to manage their emotions, helping them develop positive relationships with peers or with their family, and helping them become more involved in things that are important to them in their life.